Usually people think the manufacturing or the cell product producing is very difficult to make it clinical stage. But we succeeded to overcome those issues in 2014 already. And the point was that the robust protocol that cannot be affected by a subtle genetic changes during the cell culture. And we targeted our target is RPE, retinal pigment epithelial cells that have the pigment. And that was a good point because we can purify them by colors and we can avoid the contamination, as I said. So we could get the pure cells and the complete safety of those products. So now we are thinking our issue is what kind of cases is the suitable for those treatment. Because I'm still doing an outpatient clinic every week, and I see many patients of the age-related macular degeneration and the retinal degenerative disease. And each case have various condition. And the regenerative medicine's effect is determined by the host environment, not by the cell product. So selection of the patient is very important. So our issue is choose the right cell types for the right cases. That is the most important thing now.